disease. We are, during this program today, going to be looking at things like eating healthy, drinking lots of water, having enough sleep, avoiding stressful situations. We know that persons are very anxious right now, and understandably so, but we want to look at things like that, how you may be able to see how your stress levels are a little less. We want to look at physical activity, increasing physical activity, ensuring the necessary amount of physical activity is maintained, not overusing alcohol, avoiding smoking, looking at the weight and that kind of thing. So we're hoping that we will have a very nice discussion with our chief nutritionist and our population when the calls come in.
Thank you so much. But before we go into the discussion with Lisa Hunt, if you could tell the St. Lucians, what are chronic conditions? Because for some persons, they might be wondering, what is chronic conditions?
Okay, when we talk about chronic conditions, we're talking about diseases which are not diseases that you have today and you could go to the doctor and cure and continue with your life. But chronic conditions tend to be long-lasting. They can be controlled but not cured per se. So we have what we call the major chronic conditions. We look at diabetes, cardiovascular disease. We look at high blood pressure, strokes, that kind of thing coming under cardiovascular disease. We look at chronic lung conditions like asthma, chronic obstructive lung disease are actually chronic diseases as well. And we look at cancers. Generally, these are the major chronic diseases. Arthritis, of course, is one of the chronic diseases that most persons as they age would have. And so we look, and when we talk about the chronic diseases in the general sense, we're looking at the major chronic diseases: diabetes, cardiovascular disease, chronic lung conditions, and cancer.
Thank you very much. And now we will have Lisa Hunt, who will speak on healthy eating and also maintaining a strong immune system.
Okay. Thank you for having me. Good afternoon, Saint Lucia. During this pandemic, we realized that the tendency for people to overeat and to be inactive is extremely high, and therefore persons need to be mindful of the physical activity levels and also what is it that they consume, what they stock up on at home. So we also, during this period, we want to ensure that our immune system is strengthened. And so I will give the public some tips as to what they can do to eat healthy and how they can be physically active at home. So looking at how do you maintain healthy eating habits. You must ensure that you consume foods from a variety of foods, like from our 6 food groups. Ensure that we consume plenty of fruits and vegetables. I say this because looking at the diets of our St. Lucian population, fruits and vegetables are lacking. And so we know that they are laden with with vitamins and minerals and fiber and antioxidants, which help to build the immune system. So we want to ensure that that people consume, of course, our local fruits. We have in season wax apple, banana. We know they're high in nutrients, in vitamins and minerals, and so we want to ensure that you consume adequate of that. Also, you want to drink adequate water, plenty of water throughout the day, because right now it is very hot. So you may be consuming 1 liter of water, 1.5. You need to consume more than that because it's extremely hot. So drink water several times throughout the day. Eating a variety of foods. I mentioned our fruits and vegetables. I'm going to go back to that. You have to ensure that you have your legumes, your peas and beans. When you are choosing foods from animals, you must ensure that you have leaner cuts of meat. For chicken, you want to ensure that you're removing the skin, remove the visible fat to ensure that you're having less of saturated fats and also trans fats. Then, what are the other food groups that I'm missing? Fats and oils, you want to ensure that you choose healthier options in those and avoid the trans fats. So you want to ensure that you have healthy fats and oils and avoid trans fats. Other food groups, your staples, you want to ensure that you have whole grains. And by whole grains, I mean foods that are not processed, because ultra-processed foods are very high in sugar, they're very high in salt, and so they will do damage to your body and cause more adverse effects than building your immune system. So you'll be looking at our provisions, you're looking at corn, you're looking at oats, Cereals, when you are choosing cereals for yourself, for your children, you must ensure that the cereal is low in sugar, because a lot of cereals are laden with sugar. Please ensure that you read the labels. In the labels, it will indicate how much sugar is there in grams. You want to look for cereals that are high in fiber. So high in fiber, low in sugar, low in salt for cereals. Then you have our other cereals like oats that are whole, because the cereals that are packaged are actually processed as well. But you want to ensure that you're having the whole grain ones like oats, like cream of wheat and all the others. So other staples, apart from provisions, our cereals, you have brown rice, you have corn. There are plenty of staples that you can choose from. But just ensure that whatever you are choosing, that they are whole and they are not processed. Then you're looking at what are the food groups that are missing? Our 6 food groups, our staples, our fruits and vegetables, our fats and oils, and our legumes. Meats, I talk about meats already, that you choose those that are leaner and remove yeah. For physical activity, you want to ensure that most persons, you know, our life has changed. Most persons are at home because of the COVID, and so you are not able to go out like you used to. And so we have to be able to improvise and see what is it that we can do to be physically active. You probably had a structured exercise program, and so you home. People tend to be more sedentary because they're home, and being more sedentary, you increase your chances of having more health conditions and working against building your immune system. So you must ensure that you are physically active. So what are the things that you can actually do to be physically active? Simple things. You can walk up your steps up and down a few times for the day. The recommendation for adults is 30 minutes a day, and for children is 1 hour. However, you do not have to do the 30 minutes all at once. You can do it at intervals. So if you feel like climbing the stairs a few times for 3 or 4 minutes, you climb your stairs. Then other things you can do. If you love dancing, you put on your favorite music and you dance. Physical activity does not have to be structured. Exercise is structured, but physical activity, anything that you can do to move. If you have space around your house, have your children ride their bicycles, run around, play with your children, is just getting the body moving. And this is really for you to maintain health. Other things that you can do apart from dancing and walking up your stairs, you can do gardening. And while we are going through this pandemic, it is a very opportune time for persons to grow their gardens, because it helps to expend energy using your tools. Talking from experience, you can expend quite a bit of energy doing your gardening and not even knowing what the future holds for us. Ministry of Health, Ministry of Agriculture, we have been trying to get persons to consume more of local foods to reduce on the importation of foods, and I'm saying that this time is a very opportune time for persons to grow their own foods in the garden. We have the time. Some persons are at home, and it's also a form of physical activity, and you are growing foods without chemicals, which also helps to build your system, helps you to be healthy, and also can get the children to be engaged in knowing where their food comes from, how they can grow food, and so they're more likely to consume the foods if they can see how it is grown. So you can make it a family event, make it an activity event, make it fun. I know that being home can be depressing for people, but if they are physically active, some research has shown that physical activity helps your mental health. And if persons may be prone to being depressed or even having negative thoughts, being physically active will combat against that. So you want to build your immune system with physical activity, with food that will help you to be able to fight infections, to build your immune system to fight not only COVID-19 that we are experiencing right now, but also the chronic diseases that makes persons susceptible to getting COVID.
Thank you so much, Ms. Hans. Now we're going to ask Dr. Cyril Filbert to give some recommendations for persons. For instance, if somebody is diabetic or has cancer, what recommendations would you provide for those persons with those conditions as it relates to eating and also in terms of activities they can get done?
Okay, in terms of chronic diseases, like Lisa was saying, our nutritionist, at this time when people are actually at home, it can be a little discouraging in terms of doing physical activity and so. So I think I just want to follow what she's saying. I think persons need to be creative, whether you have diabetes or whether you overweight or obese, whether you have high blood pressure. The research has proven that physical activity actually improves blood pressure levels, blood sugar levels. Actually, it makes you feel better, like the nutritionist would have said. So I just want to say that that's one of the things that I would recommend, that persons try at least walking around the yards and engaging, listening to music, putting YouTube exercise videos on and doing that in your living room and so. One of the other things that I was thinking of as she was talking is that we have seen, the research has shown that we have a problem with overweight and obesity in Saint Lucia, and it is concerning that persons are now at home, they're not as active as they are accustomed to being. So one of the things I want to recommend for persons who are hypertensive or are diabetic is that they pay attention to the weight through probably your bathroom scale. So you check to see if you're probably putting on weight, and of course, as you see probably whether or not you've put on a pound or two, you can now do something about it. You can become more, proactive with the knowledge and so. In terms of diabetics, one of the things that's very important, apart from the physical activity and making sure that they're less stressed, is the diet, which Mrs. Mitchell would have made mention of. Trying to avoid juices, and so it's very tempting. I realize that we're in the mango season. We have lots of plums around and so on. We're not saying that, let's say, diabetics shouldn't be eating fruit, but of course, they need to be mindful of the portion sizes. They need to be mindful of probably if you eat the fruit, you shouldn't go and try to drink the juice as well. Actually, we would recommend drinking water instead, ensuring that as a diabetic or as anybody for that matter with any disease or just a healthy person, that you ensure that you have your 6 to 8 glasses of water and you limit the juices. Have more natural foods, or foods in their more natural state tend to be healthier. We tend to consume a lot of processed and ultra-processed foods, and the research has shown that drives the obesity epidemic. Of course, the obesity epidemic drives the diabetes, drives the high blood pressure, drives the heart disease. So it's something that we want to be mindful of as persons with chronic diseases, and even persons with children at home, that we look at things like that. So as diabetics specifically, one of the things that we want to ensure diabetics do, if you have a glucometer at home, try to measure your blood glucose readings in the morning or after meals so that you can actually pay attention to how well you're doing. While you may not be able to go to the doctor as often, these are some of the things. Blood pressure as well. If you have a monitor at home, check your blood pressures. Don't just take it for granted that the blood pressures are fine because you don't have a headache or that kind of thing. So we want to recommend those kinds of things.
Can I add to the sugar, because that's one I left out. Persons must ensure that they limit the intake of sugar, because sugar can weaken your immune system. Sugar can do a lot of damage to our bodies. It increases our chances of becoming obese or putting on weight. And so we must ensure that we cut down on sugar. Not only on the visible sugar that we see that we use, but she mentioned the juices that are very high in sugar, but also other foods that, especially the children are at a home. Mothers tend to buy lots of biscuits and really junk food that has no nutritional value, and so they are high in sugar. They're also high in salt, and so you want to limit these. Try to give the children healthier options for the snacks. Try to give them something like fruits. If they're old enough, you can have some unsalted nuts. You can give them a salad. I find children like cucumber salad. try to get the children away from eating the junk food, because we are not doing anything good for our children or our bodies by giving them such foods. A lot of, I don't want to use any terms, but some of those high crisp, they're very high in salt, and I tend to find children consume a lot of that. So you want to, let's use our monies wisely and to buy healthy food to help build our bodies, and the packaged highly processed or ultra processed foods should be avoided. And I know being home that the tendency for people to, you're in the house, the fridge is there, the cupboard is there, and so if every time you pass, you might want to binge on something. We want to avoid these types of behaviors. And for the children, get the children to be engaged in activities so that they can not only focus on food, but focus on improving them as a whole being, a holistic child.
Thank you so much. Well, right now we will take a break, and when we return, we'll have the Creole segment. Após nous kay parti pause, ek le nou viwe, nou kay ne discussion a Creole.
Coronavirus? I am worried, Gassa. It's only old people dying from that.
Hold up. Being young does not mean being safe. Yes, it's true that the elderly are at higher risk, but anyone can get the virus. The effect is even worse if you have a chronic condition like hypertension, heart disease, lung disease, and diabetes, or weakness in your immune system. If you are living with these conditions, be extra careful. Wash your hands with soap and water. Use hand sanitizer with at least 60% alcohol when hand washing is not possible. Avoid touching your face. Take steps to boost your immunity through proper nutrition, exercise, rest, and take your medication as prescribed. Limit being around people who have flu symptoms, even close family members.
Our health is in our hands. Together, through simple actions, we can stop the spread of coronavirus. This message was brought to you by the Bureau of Health Education of the Ministry of Health and Wellness.
Welcome back. Right now, we will have a session in Creole. À présent, nous kay mande Dr. Shanacer Philbert pour banwati mo parole à sous affaire di asiwe ou en bonne santé si ou ni maladie comme pressure, pisadou, cancer et l'autre maladie di ou en ça là côté nous ni COVID.
OK. Bonjour Saint Lucia. Nous comptons chez nous ici à la EPO pour nous parler EPO about santé. Bon, question ti madame l'a demandé, c'est une question qui est really importante. Puis là nous regarder ça qu'a fait la Chine et Italie et States là, nous avons c'est moun qui a fait mauvais avec COVID, c'est moun en chaidele qui pli grand, puis vous savez pli moun qui a pli grand, pli yo qui a pli malade, mais aussi moun qui ni problème nous ka couyer chronique comme problème pressure, pisadou ek maladie qu'on a ek yo pas ka agir bien ek yo pas contrôle ces maladies ça là. So nous là ici aujourd'hui pour make sure nous parler avec vous about ces maladies ça ek sou ni ces maladies ça comment manière pour make sure c'est pressure bon cycle bon make sure ti corps en bonne santé et que ça fait bien même si ou ka joindre COVID.
Est-ce que ça parle teasing pli à ce qui recommandation qu'a fait pour ces moun là parler de manger yo kay manger.
OK, so là nous ka parler maladie chronique et ben n'importe moun si nous ka parler ça. Nous ka parler garder ça ou ka manger. En chaide là nous aime manger bay nous ka gain en magasin qui yo ja comme si yo ja tie toute substance manger en dedans et ça qui ka wete c'est en bas de sel, en bas de graisse, bay qu'on qui pas bon pour nous puis c'est bay ça qui a pli détruit santé nous. Mais nous ni pour manger bay qui pli natural, bay fruit. Si nous c'est greens nous bay qu'on nous ni pour manger plus especially si nous ni malade puis nous ka joindre chaque vitamines et minerals et bay qu'on manger c'est manger ça là pois nous noix nous ni pour boire là où ni malade ben n'importe monde nous ni pour make sure qu'a boire assez glo about 6 pour 8 verre glo pour jour et pour try pas boire chai j puis j même qu'a mener sick en dedans corps et sick là même qu'a tourner grosse et qui qu'a fait nous vin gros il qu'a fait nous ni plusieurs maladies so nous qu'a garder l'autre bail là c'est make sure moun qu'a faire physical activity. Make sure pas acide même côté à pour journée à regarder TV et ben qu'à écouter radio on y pour qu'à lever chaque about 10 minutes de temps lever by un petit mouvement tout ça qu'a fait bon pour santé moun se joie nous lever by warm là moun pour regarder try pas boire warm puis c'est pas bon sous café mais on y pour quitter by c'est ça nous kayam recommander mon fait.
Merci Achai. Et Lisa Hunt, est-ce que ça parle de qui qualité manger, mon sa manger, di temps ça la côté mon la kayo?
So à présent nous la kayo nous plus passer avant. So nous voulons pour nous manger, bon qualité manger pour faire système nous fort. Nous voulons manger quoi dit, nous voulons manger fruits, nous voulons manger un chai régime, sur le salaison, manger poisson primaire passer viande, nous voulons pour manger poisson peut-être à 2 cours dans semaine là. Là au cas servir chicken poule, là au cas servir poule, vous voulez pour tirer la peau poule là, là au cas nettoyer, tirer toute graisse là qui en les poule là. Et even manière ou ka boui pour la important ou pas vle pour ka fruit plutôt pour ka fruit manger il pli meilleur pour ça boui et ben pour griller et ben pour steam parce que ka fruit parce que top manger fruit top l'huile pas bon pour quoi et nous voulons tant à présent nous voulons pour faire nous quoi fort pour ça goumer empêcher nous hen COVID-19 et l'autre bagay qui ka aller nous pas ça ka venir encore so nous pour make sure nous préparer nous pour faire quoi fort so c'est si nous manger bien nous manger régime nous voulons manger régime qui ni ça ka dit qui naturel qui pas ni pièce chimique dedans qui pas ni pièce l'autre bagay qui body qu'on nous pas briser ou voulez manger pois vous savez en chaque monde a besoin pas manger pois qu'on nous dit manger l'autre nous voulons manger plus pois et even là ka manger on pas mettre top sel dans manger parce que top sel pas bon sel sous manger top sel il ka fait pressure monter et nous moun ka hen stroke et puis pressure c'est bail ça so vous voulez couper à sous sel là ou ka mettre ya but even là moun peut pas mettre just sel mais yo ka dit well OK ma mais just sel mais yo ka mettre l'autre qualité saisonnement qui bien sel so là ka gen saisonnement vous voulez ça qui naturel ça quoi crier ça ou ça tirer from terre et puis mettre en dedans manger parce que ça qui package qui ni sel en dedans so ça sous ça aussi important nous voulons pour ka boire de l'eau en chai especially prestement il chaud ces jours vous voulez boire en chai de l'eau pour tirer toutes ces toxines là qui bord là pour aider nutrients pour absorber pour quoi ça servir vous voulez pour qualité là où la caillou à présent moun ka senti ko yo peut-être yo ka worry yo ka stress parce que yo pas ça demain ka chebe mais on est pour try pour be plus active faire plus exercice pour ça fait quoi move quoi parce que si on pas faire ça on met comment dans manière pour ça prendre plus maladie. So la ni chai ti bagay nous ça fait ou ça courir ou on caillou sous ça moun qui hafit ou ça sauter corde ou c'est n'importe bagay qui kay faut move body ya then il bon c'est ça quoi que physical activity nous voulons pour moun ka pas ka assise toute l'air because là ka assise son pas ka circulate ou voulez son ka circulate pour ça quand ça travaille bien so sou aimer ça moun la ni moun qui aime danser ka mettre musique ou si c'est western ou content si c'est jungle whatever il y a content ou ka mettre pour ça danser pour si c'est combien minutes là now nous briser about 24 20 minutes exercice so ou pas besoin faire tout en seul coup ou ça fait un différent type journée mais vous voulez un bout de journée ou 30 minute exercice. So moi ka encourager moun qui la caillou à besoin pour faire ça ça fait pour faire corps plus fort. Manger bien. Manger ça ou ka planter ou la caillou ou pas même briser en terre pour ça en kayado à besoin moi ha moun ka planter patate en dedans en flower pot. So là ni bagay nous ça fait qu'on nous la caillou nous pour ça faire nous manger plus meilleur. OK, et coupa sous cycle là cycle ka fait qu'on nous plus faible ou voulez manger boire plus d'eau avoid by ko juice et puis soft drink c'est bail ça pas ka fait pièce bail bon pour santé nous voulez pour nous ça manger fruits pas faire giek fruits manger fruits coigné parce qu'il est naturel et puis ni nutriments qui kay fait corps plus fort et c'est ça nous ka try pour aimer besoin là.
Merci. Et puis Dr. Sarah Philbert, est-ce que ça va nous qui commission ni pour ces moun là qui ni pressure et puis ça fait di pisado ati commission ba yo
moi voulais dire c'est moun là qui ni pressure pisado on y pour quelque nous ça aider so ça les docteur ai ouais docteur pour docteur aider avec tout ça pour faire mais là regarder ou même si pas faire ça au besoin faire nous pas river pièce côté. So là on y pisado là on y pressure sur anti-tac go on y pour make sure qu'a garder ça ou qu'a manger comme Miss Hunt dit on y pour make sure ou qu'a bay corps mouvement pas assis dans les chaise là qu'avait TV en whole journée et ben par l'exemple bay corps mouvement courir c'est maman là sur ça aller dehors à l'anti-jardin bay kon aussi on est pour make sure sur notre machine ou ça check siku pour savoir qui nouvelle cycle là est pas juste dit eh ben ma santé trop malade so moi même le cycle là bon plus ou dit ça si quelque pressure ça ba qui pas ba tellement signe en bas ba mauvais so pas vle ba tellement mauvais ou pas savent ou vle pour précaution so on est pour make sure ka check sur notre machine là ka ou sur notre machine pour check pressure ou ka check pressure aussi pour make sure ou garder coyer sur avec là ou ka check pressure en dépendant ça ou ka manger délai ou ka savent mais moi manger en cholomo hier et garder pressure tellement aujourd'hui so là ou ka garder bail qu'on ka savent OK ben na quitter la moya puis la moya ni trop sel et qui ka mener pressure moi monter et na manger l'autre bail mais si ou pas check ou pas connaître bail qu'on et bail qu'on ça aider ou si on a ti scale ben on a ti bail pour ça faire way tout ça ka bon puis délai qu'on nous home et nous pas bay qu'on nous tellement mouvement qu'on nous te ka bay nous te ka aller travail monter descendre nous ça mettre un petit tac plus gros sec a plus ou ka mettre gros sec plus pressure ka monter plus cycle ka monter so ou voulez make sure bay qu'on ka check en les aussi garder celle là manger garder ça son épiçado changer try manger plus greens, plus manger qui plus natural passer caboué bay kon jus, manger bay kon bonbon, bay kon rempisser un problème coagani et cycle so ou voulez try pas mettre trop cycle encore même si ou ka pour médecine là puis ça chaque délai nous ka catcher ben na point insuline là na point tablette là moi ça manger n'importe ça moi voulez ça pas vrai pièce tablette là insuline là ka aider ou même ni pour aider corps pas ça ou ka manger ça ou ka boire qui hors ka mettre corps.
Merci.
On bagay moi oublier dit aussi c'est quantité manger à nous ka manger parce que moun peut dit OK yo ka manger bien yo pas ka manger pièce ça nous ka créer junk food mais quantité ou ka manger si ou ka manger un plat qui ni en chaile vous manger ben ça c'est trop parce que go manger là on manger qu'on mange tout bagay qui ni starch il ka tourner en cycle body nous briser mais nous pas briser autant so on peut garder quantité manger ou ka mettre dans le plat là et puis couper à souiller parce que un chat on ka manger plus passer yo briser et si nous la kay nous ko pas faire activité qu'on te ka faire avant ou briser even moins so pay attention pour ça
vrai nous pas pour auto manger.
Merci. Ça vrai information ça too important. Now we will take a few questions from the public. Persons can call at telephone number 468-2162 À présent, nous allons point couiller, moun sa couiller et puis question. Yo sa couiller numéro 468 D yon 6D.
Breastfeeding. Can I talk about breastfeeding?
The question is for Lisa. Can someone who is positive with COVID-19 breastfeed a baby?
Yes, they can. According to World Health Organization, that people who are positive, they can breastfeed. However, they must continue with the measures, you know, make sure that they wear a mask, practice good hand hygiene, making sure that they're washing their hands or sanitizing their hands as much as possible, and try not to talk all over the child while they're breastfeeding. But because breastfeeding is so important to the child's health, they are recommending that they can breastfeed a child while you. And I would like to really, really emphasize that while people are at home, that they breastfeed their children, because most times one of the barriers to breastfeeding is that mothers would say that they have to go to work, and that's why they cannot continue breastfeeding. So while persons are at home, I would encourage them to breastfeed their children, because this is the safest and the best nutrition for the baby. Okay. And they can breastfeed 0 to 6 months, exclusive breastfeeding, nothing else to give the child at 0 to 6 months. And after 6 months up to 2 years, you can continue breastfeeding with ensuring that you add solid foods to the child's meal.
Wonderful. And for Dr. Shanna Seraph-Filbert, we know that for some persons with chronic conditions, during this time they might be experiencing some stress. What recommendations would you make to them?
We look at things like one of the things we observe is persons would be unemployed because of COVID. That is a stress factor in itself. In terms of finding funds, etc. We also have the fact that children are at home. In some cases, we have extended families. So grandma now has the grandchildren at home all week, as opposed to probably just having them after school and so. So persons may also be stressed out just by way of their illness, because they can't access what they were accustomed to accessing. They can probably go out walking, meeting with their friends and that kind of thing. One of the things we want to recommend is that persons not isolate themselves, because isolation itself can lead to depression and persons feeling very sad and so. So we want to encourage the extended families. Let's say mommy lives one place and then she has her children overseas or that kind of thing. We want to encourage persons to make sure they're checking up on the older ones. We also want to encourage just generally persons, even if you don't have a chronic condition, that you reach out, not necessarily physically, but you reach out to others. Don't spend a long time just by yourself in your thoughts and so. Speak to others. One of the things that we know is that most people have the same situation. There are persons, quite a few people are unemployed. So it's not just one set. A few people are concerned about the finances and so. So as you speak about the problems, you tend to decrease the level of stress. Also, as the nutritionist would have mentioned, things like listening to your favorite music or probably watching a program, doing those things, using social distancing, of course, that make you happy and keep your spirits up. Physical activity is one of those things that actually allows what you call our happy hormones to come out. And of course, in a situation like that, we really need all the happy hormones we can get. Going out in the sunlight, not when at midday, of course, but you know, when it's not too hot, things like that can help improve symptoms of you know, depression and so. And of course, if it is bad, of course, persons need to make sure that they go to the doctor and get the care that they need.
Thank you. Once again, our lines are open. Persons can call at 468-2162. Okay, so one of the things that might be of concern is that you find that persons are drinking alcohol. If you could touch on that and probably speak as to how bad it is for the body.
Alcohol is a drug. There's no actually, how would I put it? Alcohol is not a part of the food groups.
Benefits.
Okay.
Benefits.
It's not water. We actually, our bodies don't need alcohol. That's the long and the short of it. Alcohol causes dependence, which is one of the reasons why persons would start drinking alcohol, and then all of a sudden they can't stop after, you know, a while. We have an issue with alcohol in Saint Lucia. Most of us know that. One of the problems we have is that children are being introduced to alcohol use very, very early. And that is bad. Because as we introduce them to alcohol early, we're making them alcoholics by the time they, whatever age, which is not good at all. In terms of the effects of alcohol on the body, initially, as somebody drinks just a little bit of alcohol, alcohol tends to make your stomach feel a little warm, your heart rate go up, you can have a nice little feeling. As you continue drinking, it breaks what you call your inhibition. So you feel like, if you're probably a young man, you want to chat a girl, you feel like you can chat her all of a sudden, you're not nervous anymore. But that's until we get to the downside. Alcohol suppresses the nervous system and so on. The person who drinks, by the time you get to probably about 6 units of alcohol, you're not thinking clearly, your judgment is impaired. So if you're driving, of course, that's bad. You also starting to not behave the way you usually behave. So generally we'd see persons drinking alcohol and you know, if there's a party or something, you may have people fighting. It's because of the effect of alcohol on the brain. Alcohol affects the brain, it affects the liver. So alcoholics can get liver cancer, they can get fatty liver, they can get cirrhosis. The blood pressure, alcohol raises the blood pressure. Alcohol causes all kinds of other cancers, what we call gastrointestinal cancers, cancers of the mouth. Alcohol causes domestic violence, we know that well. So really and truly, alcohol in itself is something that we need to avoid. We talk about social drinking and so on, but one of the concerns is, where do we cut the line from going from social drinking to what we call harmful use of alcohol? Case in point, we realized there was actually theft. So we put a ban on alcohol, and persons saw it necessary to steal alcohol. Because of course, if you have dependence, if you have persons needing alcohol to survive, and that's what it actually gets to. We talk about alcohol dependence and withdrawal. Persons who've had alcohol every day for years, take them off the alcohol and all of a sudden they have seizures and everything else. And this is serious. I think alcohol is something that we really need to look at. We need to be careful with as parents, trying not to introduce it early or not at all, if that's an option.
Can I add a little bit to that?
Yes.
Can I add? Yes, just to add to what you're saying, and you know, I've spoken to parents sometimes, and they say, like, you know, for example, they will have like a shandy that has probably about a 1%, 2% of alcohol, and they don't see that as alcohol. They just see it like a drink. But introducing children to 1% or 2% alcohol, you're basically getting them to like alcohol. And so when they get older, they tend to, you know, gravitate towards having more higher percentages. So, and like you were saying, to add to it, you know, it affects your immune system, it weakens it. It also affects the absorption of your nutrients. You'll be having your meal and you're having alcohol, and alcohol is the first thing that will get to your head before any of the nutrients are absorbed. And so that affects your nutrients and how your body would function. So there is nothing positive about alcohol. It is not part of a healthy lifestyle. It doesn't form part of it. And so the body does not need it.
Thank you. And before closing, if you can give us a final message to the public. You can go ahead, please.
Okay. So we want to reiterate the importance of healthy eating, ensuring that you're having a variety of foods focus on having natural, local foods that is not processed. Limit your intake of sugar as much as possible. Cut back on salt. Ensure that you are drinking water to cleanse your body and to keep your body hydrated. Stay away from alcohol because it has no benefits. Persons who have young children, make sure that you are breastfeeding them and be more physically active. Dance to your favorite music, do some gardening, plant some food, and then you'll be able to get some healthy foods from that.
Thank you. Dr. Sarah,
I just want to say that 1 ounce of prevention is worth a pound of cure, and I really think that as we are at home or as we're in partial shutdown, we really need to take this seriously in terms of lifestyle diseases, chronic diseases. If you don't have a chronic disease, do what you can during this period, not so that you don't get one. Right. Make sure you're on top of your exercise now that you have the time. Make sure that you're preparing your meals as opposed to buying them ready-made, and making sure that you have time to prepare a nice healthy meal for you and your family. Make sure that you're watching the videos that may teach you how to cook healthy foods, watch the salt intake, things like that. Make sure that you're feeding your mind positively so that you are not depressed, etc., that you're doing things that raise your spirits as opposed to depressing. Making sure that you're paying attention to your blood pressures, blood sugars, because you now have the time to measure, because most of us are not rushing off to work and so. So I just want to keep us to keep that in mind, that this is a good time to make sure that we prevent chronic diseases, prevent the complications of chronic diseases, and prevent us not doing well if we get COVID by having a healthy immune system.
Thank you so much. Well, it was definitely a pleasure having you here with us today and providing us with valuable information as it relates to maintaining a healthy lifestyle during COVID-19. Thank you.
You're welcome.
Well, that's how we come to the end of this live press conference. On behalf of the entire production team at GIS NTN, I am Fennel Neptune. Thanks for watching.